talk about that. We've got a moment to bring in one of our favorites and the best expert to discuss this. Dr. Aileen Marty is an expert director of the Infectious Disease Department at FIU. I know you've stepped out of a meeting. I appreciate the time. It's been a while.
Oh, it's always a pleasure to talk to you. But yes, we're deep into the problem of the public health emergency of international concern that was just declared on the 12th of August on Mpox. So, but that's okay. I'm more than happy to talk about vector diseases that you're referring to, by both mosquitoes and by midges and other.
We'll make it quick for you. Let's talk South Florida first. This Oropouche virus, the sloth fever, 21 cases confirmed here in South Florida. Broward Health just putting out a statement this morning confirming cases in Miami-Dade, Broward, Duval, and Hillsborough. What should we know?
So Oropouche is the American way of saying it. Oropouche is how you would say it in Spanish. That particular virus is a potentially dangerous virus. The cases that you mentioned that were outlined by the CDC, 20 of them were imported from Cuba to South Florida. One case was imported from Cuba to New York. This virus has killed two young women, a 21-year-old and a 24-year-old, who were not pregnant, who had no underlying conditions. Both of them had neurologic and hemorrhagic symptoms. Now, that is uncommon for this virus to cause that level of disease, but this virus is changing, as are all of these, because they're all being affected by the heat.
Right. I know you've got a meeting to get into, so just a couple other questions. I see there are treatments for these illnesses, but also that most of our healthcare professionals aren't really trained to spot them because of the symptoms could mean a whole lot of different things.
Well, the symptoms on many of these, like dengue, chikungunya, they overlap. So they'll have the headache, the high fever, the retroorbital pain, the nausea, the vomiting, the skin rash. You can see as joint pain, right? They can differ a little bit, but not necessarily so. And of course, dengue and Oropouche can both be hemorrhagic fevers, although both, that's the least common way in which they manifest. But still, that means that physicians have to be attuned, and other healthcare providers have to be attuned to the possibility that any of those may be circulating. Because remember, a percentage of people, in the case of, for example, Oropouche, about 60% of people get symptoms, but about another 40% will not have symptoms, will have the virus in their blood, and if they're importing it from Cuba or Peru or Bolivia or Brazil, etc., they may not know that they've brought it in, and then our arthropods are biting midges in the case of Oropouche, or mosquitoes in the case of dengue, etc., are going to get infected, and that becomes the problem.
Last thing for you. It now turns out that it's not even just happening here. There was a death from Eastern equine encephalitis in New Hampshire, about 40 miles from Boston. They're even instituting curfews. Dr. Anthony Fauci hospitalized with West Nile. Is something bigger going on here that we should be concerned about?
Yes. When there is heat, the rate of reproduction of mosquitoes is faster. The rate of production of virus in the arthropods is faster, and so you get more virus being released per insect per bite, and they bite more when it's hot because they get hungry sooner, and our immune system is down. So all of that is a combination of seeing more cases from infection from these bites. Of all these various different viruses.
Dr. Aileen Marty, Director of Infectious Disease at FIU. I know you've got to get into a meeting. Always appreciate your time. Be well.
Thank you. Thank you so much. Take care.